So now let's look at data specific to South Carolina. The Catawba Care Coalition is the local organization that does a lot with HIV outreach. And in talking with them, they say that in our area, and if you look at the map on the right, you can see York County, fortunately, is one of the lower incidence rates in the state. And that most people here have HIV as a result of drug use. That tends to be the most common mode of transmission. That's just here in York County. But if you look at the map on the left and you look at the areas within South Carolina where there are the highest rates of HIV/AIDS infections. So 3 of the highest rates in the nation. So definitely needing to do some intervention, some public health, some education, get people into treatment in Greenville, Columbia, and the Charleston, North Charleston area. So if you look at the data, you can see these just go through 2005. This is within South Carolina, and these kind of mirror the national data from the CDC in the previous slides. And that, fortunately, it looks like the cases are going slightly downward trend, which is great, but still African Americans by and large are the most disproportionately affected, with both African American males and African American females being affected, and with white females having the lowest incidences. So this is probably a review from Health 300, or perhaps maybe the sexuality class with Dr. Hamill. If you took that, how do we prevent AIDS? Of course, abstinence is one thing. Get people tested. People are afraid to get tested if they've had a lot of sexual partners. Staying in long-term monogamous relationships. A lot of people are monogamous, but they're very, very short-term relationships. So people who have long-term, years versus weeks or months relationships. Of course, use of condoms still appears to be one of the best screenings. Staying away, not getting other sexually transmitted infections if you're getting other screenings. Avoiding drug use, dirty needles. And then, of course, follow universal precautions. I mean, this type of stuff, we're wearing gloves and face shields and things at the dentist, and having sterile environments in places like tattoo parlors. That stuff didn't exist until the 1980s, till the blood supply started to be tested. I mean, most of you have probably grown up with that, but that was not always the case. And, and that was how people could get, HIV through blood transfusions that weren't tested, or that there wasn't the sterilizing procedures that they have in places like dental offices and medical offices. Other problems that people with HIV can develop, just as a result of their illness, they are prone to atherosclerosis and heart disease. They tend to also be very low active, so they can develop diabetes. They can develop neuropathy as a result of HIV itself. They get something called lipodystrophy. So they get a redistribution of their body fat. So they get fat deposits to their upper back area. So that's something that's really unique to HIV, where you get this fat deposits in the upper back, lower neck area, and to the abdomen as well. Obviously, fatigue, that sort of goes without saying, anemia, and they do have mitochondrial abnormalities, which of course is going to probably interfere with their ability to exercise.